So what I want to talk to you about in this module is ways that I have found effective at creating value for very specific procedures. Okay? So I'm going to use one of my patients, and this is really a hard kind of thing for me in some ways, because this is a patient that's been in my practice a long time. So I've seen him over 15 years. I treated all of his posterior teeth. He loves drinking Pepsi Cola. And I treated all of his posterior teeth 15 years ago. So 16 restorations, all inlays, onlays, crowns, okay? He loves having his teeth cleaned. He doesn't have any periodontal issues per se. He just loves having his teeth cleaned. And so he comes into our office every 4 months. So I see him 3 times a year. Okay? So if you said to me, who's a patient that is loyal to my office, who trusts me, who sees the value of our practice, I would think he has to be like one of the highest value patients we have in terms of understanding what we do in my practice. Now, what you're seeing on his anterior teeth, there's tons of facial erosion. It's from the Pepsi Cola. It's been patched with composite. It's never looked really terrific. He hasn't slowed down a bit on it. We've talked to him about doing veneers on the anterior teeth. The linguals of the anteriors have no wear whatsoever on them. And so we've gone back and forth every 4 months when we see him about, what's possible for his front teeth. On top of that, I've actually seen him outside the office because socially he enjoys some hobbies I do. He likes fly fishing, he likes motorcycle riding. So we've gone on a fishing trip for a day, we've gone on a motorcycle ride. Wouldn't say he's a good friend, but I want you to kind of get a sense. This is a person I have a long-term relationship with. I've been his dentist 15 plus years. I see him all the time. Now, there's a danger in that. And the danger in that is I start to think that maybe I don't have to do the same things when I talk to him that I would if it was a brand new patient. Because my brain says, this guy trusts me. This guy values us. This guy's loyal to us, right? So the bottom line is when he sees our hygienist who he loves every 4 months, she talks to him about the front teeth, she talks to him about the possibility for veneers, and he just hasn't gone anywhere with it. But out of nowhere, finally at one recall, he comes into her and he says, you know what? I don't like my front teeth anymore. I want them treated. Now, she comes over to me and I am right in the middle of prepping a full upper arch. I mean, I am as busy as I can be. And she says, how much time do you have to talk to Phil? And I said, wow. How long is he going to be with you? And she said, probably an hour. And I said, okay, somewhere in that hour, I'll be okay. I'll find time. I'll come over, say hi to him. At the end of your appointment, I'll walk him up to Debbie, our front desk. He's known Debbie for 15 years. Debbie makes all his appointment arrangements. She's done all his financial arrangements through the years on all the teeth we've treated. And so I'll have Deb just go over with him what we need for the veneer appointment and, make sure we've got the photos, the models, get things sent out for the diagnostic wax up. It'll be fine. And so I found some time. At the end of the appointment, I went over, told him how happy I was. He decided to treat his front teeth. I took Phil up to Debbie. Deb checks that we have some current models. She checks that we have some reasonably current photographs in order to get the lab communication for the diagnostic wax up. And she goes through with him the appointment sequence, basically the prep, provisionalized appointment, and then the seat appointment. And then she goes through the fees with him. And then she sets the appointment up. Everything's great. So, I wasn't part of it, but I didn't feel like I needed to be part of it because he's a long-term patient. So I go back to work and I'm happy and I think Phil's happy and the hygienist is happy and everything's great for a week. And then a week later he calls and I'm back at the chair and this is what the linguals of his teeth look like. They weren't bad at all. We replaced those old amalgams with some composites and it's just a pretty nice clean veneer case. So he calls back in a week and he wants to talk to me personally.